Angelica is a genus of plants and herbs, and it's often used in traditional medicine, particularly in Asian countries. The roots of many species of the Angelica are used to make herbal medicines. However, the Angelica root typically refers to Angelica archangelica and also Angelica sinensis. The roots and other parts of both of these plants have a long history of use in traditional and herbal medicine. Angelica sinensis is used in traditional Chinese medicine for various purposes, including hormonal balance, digestive support, and liver detoxification. On the other hand, Angelica archangelica is traditionally used in European countries for digestive problems, circulation issues, and anxiety. Plants in the Angelica genus grow up to 10 feet tall, and they have globe-like clusters of green or yellow flowers. They also tend to have a strong, unique smell due to the aromatic compounds that they contain. The scent is often described as musky, earthy, and herbaceous. Angelica sinensis is known by a variety of names, including dong qi or female ginseng. On the other hand, Angelica archangelica is commonly known as wild celery or Norwegian angelica. This type grows mainly in European countries, where it's used in certain culinary applications or as a herbal medication. Although the name Angelica root implies just the root is used, most of the Angelica archangelica supplements and herbal products contain the roots, the seeds, and the flowers. Angelica root, particularly Angelica archangelica, has some culinary uses. It's sometimes used in the production of gin and other spirits, and the leaves can be candied and used as a garnish or a decoration. However, its primary use is as a herbal remedy. It has a long history of use as a traditional medicine in Europe and Russia, where it grows wild. It's thought the most potential benefit from the Angelica sinensis comes from ligustolide, a powerful compound that comprises approximately 1% of the plant, and it provides much of its strong fragrance. In animal and test tube studies, the Angelica sinensis extract kills glioblastoma cells, which are a form of aggressive brain cancer cells. However, this hasn't been researched in humans yet. Angelica sinensis might promote wound healing by encouraging angiogenesis, or the creation of new blood vessels. There's also some early evidence that it can specifically promote the healing of diabetic wounds. This can be more severe and slower to heal than other wounds due to the blood vessel and tissue damage that high blood sugar levels cause. One of the most common uses of Angelica sinensis, especially in traditional Chinese medicine, is for the management of menopausal symptoms and other female hormonal issues. Some evidence suggests decreasing the levels of serotonin in the body can contribute to menopausal hot flashes, and the Angelica root might help to maintain or increase the circulating levels of serotonin, thereby reducing the severity and the frequency of the hot flashes. Angelica sinensis might provide protection against both osteoarthritis, or joint wear and tear, as well as rheumatoid arthritis, or inflammatory autoimmune conditions of the joints. Supplementing with the Angelica sinensis might decrease inflammation, prevent further joint damage, and promote cartilage repair in osteoarthritis. Angelica archangelica can also offer some benefits, but little research has been done on the herb. Additionally, most of the existing research was conducted in test tube and animal studies, which can only serve as promising starting points for further human trials. In test tube and animal studies, Angelica archangelica, like the Angelica sinensis, shows promising anti-cancer and anti-tumor effects. For example, it was found to kill breast cancer cells in test tubes and to inhibit tumor growth in mice. Angelica archangelica can also be harmful to bacteria, viruses, and fungi. In test tube studies, the essential oil killed disease-causing bacteria like Staphylococcus aureus and E. coli. The extract and some isolated compounds also exhibited antiviral activity against herpes simplex or the cold sore virus. The essential oil also shows promise as a potential food-safe preservative to inhibit mold growth. There's some compelling evidence from animal studies that the Angelica archangelica can help to reduce anxiety. 3 rat studies noted the Angelica extract induced relaxation and decreased anxious behaviors in the animals. The Angelica root, particularly Angelica sinensis, has known side effects and it might cause some drug interactions, while the Angelica archangelica might likewise have potential side effects. It's not been studied as much as the Angelica sinensis. There's been suspected cases of high dose of Angelica sinensis supplements causing heart problems. The Angelica sinensis may also increase your blood pressure. The Angelica sinensis might also interact with blood thinners like warfarin, possibly causing dangerous and potentially fatal bleeding in certain instances. If you're on a blood thinner, you should not use Angelica sinensis without first clearing it with a doctor. Members of the Angelica genus contain phenocoumarins, which are the same compounds that are found in grapefruit, and these can interact with many drugs, including certain cholesterol and anti-seizure medications. Furthermore, it's known handling the Angelica plant can cause photodermatitis or contact dermatitis. Angelica supplements are sold in capsule and liquid form, as well as dried for making into a tea. A standard dose hasn't been established, nor is it clear what a safe dose would be to avoid the complications and potential side effects. Most Angelica root supplements contain 500 to 2000 milligrams of powdered Angelica root or Angelica root extract per serving. If you're taking a blood thinner or have a pre-existing heart problem or high blood pressure, you should avoid Angelica sinensis unless you're under the supervision of a doctor. Angelica root is a popular herbal medicine, and it's been historically used in part of Europe and Eastern Asia. The Angelica root can refer to either Angelica archangelica or Angelica sinensis. Although each has a wealth of reported uses, there's very little evidence to support them. Most of the existing evidence comes from animal and test tube studies. For more on herbs, supplements and natural treatment plans, check out my website.